this lecture series. Today we have the honor of having Katie Devine talk about adolescent and young adult survivors. This is the second to the last in this year's series. Our next talk will be on lymphedema management, and Alyssa Bark will be presenting. Next slide. The Cancer Survivorship Outcome Center is a center that focuses on unmet needs and disparities in the state of New Jersey and trying to develop care standards and deliver care to survivors in our state throughout our Robert Johnson Barnabas Health System, and to foster some research across our health system. Next slide. Katie Devine is speaking today, Associate Professor of Pediatrics, Chief of the Pediatric Population Science Outcomes and Disparities Center in the Division of Pediatric Hematology Oncology at Rutgers Cancer Institute. She'll be speaking in a bit. As I mentioned, our next speaker is Alyssa Bark, managing lymphedema. And upcoming this fall, we have a great presentation on financial navigation for cancer patients and survivors by the leader of our financial counseling group, and then a very interesting lecture on an important topic for cancer patients and survivors, which is oncofertility. At the end of today, if you're able, please fill out a survey to indicate any other areas that you might be interested in hearing us speak about next year. Next. And we do have a questionnaire that this is the QR code, but you'll get mailed something in the email to fill it out at the end. And we do have a website, which you will also be mailed at the end, that contains a really interesting links to our website, which stores all the talks that we're presenting and hosting here over the past year, and some resources for cancer survivors. Wellness pamphlet is in English and Spanish and has very interesting and good links to emotional well-being, healthy dietary practices, and tobacco cessation, and soon will be expanded to financial resources and oncofertility. Next slide. And if you have any questions at the end, please contact Jacinta. And now, without any further ado, introduce Katie Devine, who is an expert in adolescent and young adult cancer survivorship, to talk about psychosocial needs and post-treatment care. Welcome, Katie.
Thank you, Sharon, and thank you to the center for having me. It's my honor and privilege to talk about this topic, very important topic. So I wanted to start out just telling you all a little bit about me and why I went into the field that I went into. So in 1993, my younger sister, Christy, was diagnosed with osteosarcoma, which is a bone tumor. And as many of you may all know from personal experience, it's a very challenging situation. For our family, we were very distressed by this diagnosis, and her oncologist at the time, Dr. Michael Harris, said to her, "Mark my words, I will dance with you at your wedding day." And here is a picture of him dancing with my sister on her wedding day. And that, that personal experience really has inspired me to pursue a career in psycho-oncology. I had thought myself about going and being an oncologist. For many years, I thought I would pursue that route. But what really stuck with me was how people cope with the illness and in survivorship. And that's what really drew me to want to provide care for this group, and especially for adolescents and young adults. So today I'll be talking about adolescents and young adults. I'll start with some definitions just so we're on the same page about what I'll be talking about. I'll talk about common psychosocial needs in survivorship and post-treatment care, and then we have time for questions at the end. So I'm happy to take questions. Please feel free to write them in the chat if anything comes up while we're talking, and then I'll answer them at the end. All right, so there's lots of terms in research here, and so I'll use the term adolescent and young adult, or AYA for short, because it's quite a mouthful to say it out loud. And when I talk about adolescents and young adults, I'm talking about people who are between the ages of 15 and 39. This is the definition from the National Cancer Institute. And really, when we talk about this age range, there's two groups of cancer survivors who sort of fit this definition. The first is what we'll spend most of our time talking today about, those who are diagnosed with cancer between the ages of 15 and 39. But there's also the group of children who are diagnosed before the age of 18 or 15 and then become adolescents and young adult survivors. And so there's a lot of, we actually have more research on children who become adolescents and young adults than we do on adolescents and young adults diagnosed in that age range. When I talk about survivors here, again, the definition from the National Cancer Institute is from the date of diagnosis, you're a cancer survivor. So it's a long trajectory. And for this age group, we're talking about 90,000 adolescents and young adults will be diagnosed with cancer in this year, and between the ages of 15 and 39, and about 11,000 children under the age of 15 are diagnosed annually. The good news is that science has come a long way, so we actually see pretty high survival rates up in the in the 85 or so percent. But as we know that the cure does not come without any cost. So many of our survivors have long-term physical, psychological, and social effects from their treatment. And why do we focus on adolescents and young adults? Historically, this is a group that has been understudied and underrepresented in research. NCI actually designated them as a particular, pulled them out to identify them as a unique group because of many reasons, one of which the biology of the cancers that are diagnosed and some of the challenges that happen with diagnosis are very unique to this group. So very different from children under 15 and very different from adults ages 40 and over. And part of the reason that I'm particularly interested in this group is that it's also a very unique developmental period. So besides from infancy, adolescence and young adulthood is really a time where there are more physical, social, cognitive, and emotional changes than at any other point in the lifespan. You think about development over time, people are becoming more autonomous, more independent. Peers play a much more significant role in as you become an adolescent and adult. Family, though, remains important and certainly influential on people's outcomes. And it's also a time period where there's a lot of life transition. So you think about between 15 and 39, people are graduating from high school, going on to college, pursuing careers, living independently, trying to become financially independent of their family, perhaps even thinking about starting a family of their own, getting married, having children. And so there's lots of things that happen in this age range. And a cancer diagnosis on top of that can really put a wrench in those things going as planned. There's also a time for transitions of care. So between 18 and early 20s, it's when you switch from a pediatric system of care to an adult system of care. And really the individual becomes fully responsible for their health care. And this can be really challenging for survivors as well to navigate those transitions. As you can see on the right, this is one figure that's often cited that shows really how cancer can disrupt pretty much every psychosocial domain you can think of in your life, from how people feel about themselves, their body image, their emotions, trust in health, trust in their own body, their career, finances, family dynamics, planning for the future in many domains, fertility, peer relationships, health behaviors. Pretty much cancer will touch all of these aspects of people's lives. And when you ask, in terms of the research, when you ask people to what extent did cancer have a negative impact on those lives? So you can see across the bottom here, it kind of lines up with all the circles we just saw in that figure. And as you can see here, the percentages along the y-axis here, pretty much, generally people are reporting a negative impact in many life domains. And you can see here, it reaches almost over 50% are reporting negative impacts on their plans for future children, their finances, sexual functioning, body image. And really, this is no small percentage of folks. And this is broken down. The three bars are dividing out the age ranges between 15 and 20, 21 to 29, and 30 to 39. But you can see while some domains are relatively slightly more important in different age groups, across the board, our young adults are reporting negative impact to all aspects of their lives. And so what do people need? They need supports in those areas. And what we find that unfortunately, many young adults are not getting the support they need. So resulting in unmet supportive care needs. This figure here is just showing in each area the number of unmet needs people report in the domain, physical domain, emotional domain, practical domain. And as you can see, if you look at the bars that are one or more, it's the majority of folks are reporting an unmet need in at least one of these domains. And really the numbers for physical are, over 75% report at least one unmet physical need. It's closer to 85% for emotional, and about 80% for practical needs. So it's there are a lot of needs that our AYAs have. And unfortunately, these unmet needs often result in distress. So the research suggests about 25% of our AYA survivors will experience persistent distress. And that number does vary depending on the article, but it's a large subgroup will experience this. And these unmet needs often result in disruption to achievement of typical life milestones that we were just discussing, like returning to work, returning to school, family planning, that are common in this age range. And so what is this distress? So this results in distress for folks. So when I think of stress, I feel like this meme over here actually really highlights what I think I look like when I'm stressed out. Just the definition of distress is any emotional, social, spiritual, or physical suffering or pain that really results in sadness, anxiety, these negative emotions that we feel when we're having these unmet needs. And often people feel that it's hard to manage these, to cope with them, and might feel stuck or worried about how to cope with them. And that's what I hope today we'll talk about, some ways that can help people feel like they're better able to manage this distress. So many of you have already heard this a lot, but our body's response to a stressor is very natural, right? We've been programmed evolutionarily wise for a long time to respond to stress or perceive stress using, our fight or flight response, where our body, the fight or flight is this arousal of our sympathetic nervous system that really prepares our body to either fight that saber-toothed tiger that's trying to chase us down, or to run as fast as we can away from it. And today's world, this doesn't have to always be a physical stressor that we see in our environment, but it often can come from our emotional and mental stressors. Just the worry about things, like a worry about cancer recurrence, is a stressor that our body can still have the same reaction to. This is a normal reaction. It's actually very healthy for our bodies to have this reaction. But when it becomes where you feel like you're constantly in that fight or flight response, that's where it can be problematic. And so what is the problem with stress? So stress can be good. And actually, we experience a lot of good stressors all the time. Think about a positive change. Think about when you're, graduating from college, or you're starting a first job, or perhaps even getting married, or in a sports competition. This type of stress is actually helpful. It gets us motivated to prepare for something, it helps us focus on it. Or if it's stress in a real physical threatening situation where something happens and you get out of that situation because you feel the stress of it. That's a good use of our stress system signaling a problem, and we respond to it. And it's usually very brief and it resolves. So our bodies go back to our normal levels. But it becomes problematic when it doesn't turn off. It can cause us anxiety. You can feel overwhelmed. We can worsen our performance in those, instead of heightening our performance in a small stressful situation, it can worsen it. And we might feel stuck or unable to fix it. And in survivorship, we might think about ways that this comes up in survivorship. So because, as I mentioned earlier, survivorship starts from the beginning of being a cancer diagnosis. And we can think about the trajectory of survivorship having different phases. And really in that those first couple of years following your diagnosis, where you're finishing treatment and transitioning off treatment, is sort of an adjustment back to normal life. And many of our survivors feel a little anxious as their medical visits start to spread out over time. Instead of seeing their physicians every day, every week, every month, now it's every few months. And so there's So there's some relief in being done, but there's also anxiety about that as well that comes up. And this is often the time too that many of our young adults talk about that they're actually finally able to process it, that during the treatment, they were just set on a schedule trying to get through it. And now that they're done, they start to process what had happened to them. In early survivorship, we might think of this as the first 2 to 5 years following treatment. Again, your medical visits start to space out. We're still monitoring now for the late health effects that happen from cancer treatment. Again, feelings of relief, anxiety. And here's also where people might start to think about how they think of themselves as a cancer survivor or not. Many people have different reactions to the term. Some people, it's part of their identity, and some people don't want to use that. They might think about how the cancer experience has shaped their current outlook on life. And then we think about long-term survivorship. So here are 6 and more years beyond treatment. Again, this might be medical visits might be, once a year or maybe even every other year for some of these tests and surveillances, or even longer. Still monitoring for late health effects, as we know that as you age, those effects are actually more likely to happen. So you're still keeping an eye on those things. But you might also really start to think about health promotion and prevention that are for anyone who's aging, needs to be engaging in healthy lifestyle behaviors. The other piece of long-term survivorship that we hear a lot is that life milestones and other anniversaries, perhaps dates of diagnoses or dates related to surgeries or other major parts of the treatment, can bring up different emotions. So some people celebrate these milestones and have, parties that they've been cancer-free for X number of years. And some people, it brings up dread and worry about it, or fears about their recurrence. And so I think it's important to recognize for yourself how these milestones and other anniversaries might influence your emotions, and use those cues to figure out, like, if you do find yourself feeling very stressed or anxious at a certain time, perhaps it's related to one of these events. This is a quote from a young adult after treatment that I think really sums up some of the feelings that I hear from many people. People assume that when treatment is finished, cancer is finished. It is not that simple. The people around you return to their normal routines, but your life is forever changed. Treatment might be over, but the doctor's appointments, the side effects, the medical expenses aren't over. It wasn't until I was finished with treatment that I could even process what had happened to me. It became difficult emotionally in a whole new way. And this is something that we commonly hear from our survivors. So what are some of these common challenges that people experience in survivorship? We talked a little bit already about distress, fear of recurrence, worry that the cancer will come back, body image. Many people will have long physical scars or other challenges, as well as just feeling different in their body. We hear that too, that it just their body doesn't feel quite the same to them as it used to be. Fertility and sexual functioning are significant concerns for our adolescents and young adults, as well as changes in social relationships. So on the graph earlier, we noted that not everyone reports a negative change in friendships or romantic relationships. And some people even report that it brings them closer together, that some of their friendships and their relationships become closer because of the experience. But other times it gets challenging when there's new relationships. How do you tell someone that you're a cancer? When do you tell them? Especially in dating relationships, this can be a challenge that everyone has to decide for themselves what feels like the right time to share that experience with others. Our cancer survivors often have challenges related to return to work or school, and financial concerns from the treatment, as well as missed work and missed school that kind of results in a delay to their financial independence. And then for many of our young adult survivors, finding the right healthcare providers is a challenge. When you go to a primary care physician as a 20, 30-year-old person, they often do not think about cancer as part of your history. And so you have to tell your story again to a new provider, and they may not be confident in managing your long-term health care. So I'll pose this question to everyone. As a cancer survivor, when you think about your future health, what are your emotions? So everyone can think what comes to mind in your head. And this is a word cloud that people have used to in describing this as an exercise. And one of the main themes that comes out is uncertainty and just worry about future health. When you're done with treatment, it's exciting to be done, but the oncology team typically tells you, there are some things we're still going to have to watch out for. And so many of our young survivors feel like you're just waiting for the other shoe to drop and waiting for something to happen. And so there's a lot of uncertainty about how their future health is. How do we manage that? So there's uncertainty in life every day, right? We walk outside and anything can happen to us. And so in most aspects of our life, we're able to manage it pretty well. But I think when it becomes this, when it's focused on health, it's a little bit trickier to manage. And so our recommendation is to focus on what you can do. Instead of focusing on what you're not sure of, what you don't know, what might happen, focus on the things you can do. So you can go to your follow-up appointments and regularly monitor for any late health effects. You can eat well, you can exercise, you can do the health promotion, you can get your vaccinations that you need to get vaccinated, and avoid unhealthy behaviors like smoking and other drinking too much alcohol, those type of things that can, for all people, are bad. And so you're really thinking about things that you could do that will promote your health and you can feel confident in. Another thing with coping with uncertainty is trying to live according to your values. So thinking about what's important to you in life and prioritizing those things. So if you really value your relationships, making sure that you make time to do those things and have those positive experiences. And really at the end of the day, we want to say that you're living life the way you want to live it, right? Despite the uncertainty, despite the challenges. The other piece, if you find that worries are really getting in the way, you want to be proactively doing things to manage those worries. So one tool that can be really helpful is journaling or writing. And so making note, you might even prescribe yourself a time of day. People often find if they do have lots of worries, they come up in the middle of the night, right? It wakes you up. It can really make it difficult to fall asleep, to stay asleep. So try to take some time before bed to write those things down, get them out of your head onto paper. Many people find that just to really releases the power over them. By putting it on paper, it can take away some of the mental struggle that you're experiencing by over and over repeating it. And also, once you start to write down some of those worries, some of them will seem really logical, like they make sense, and some of them might feel a little bit exaggerated. Right? Like, I'm not sure that that's actually true. And when you write it down, sometimes it's easier to see that and to sort of counteract against those worries and talk about what is true and what you can do. Here's another example of a quote from one of our young survivors. Anytime you go to the doctor, there's always that thought that something's going to happen. That emotion can be anywhere for survivors, not just going to the doctor. So it's important to have strategies to deal with it and not just ignore it. So recognizing that certain things are going to trigger these worries, like when you have a scan coming up or you have an annual visit coming up. But then other times they might come out of nowhere and you still want to have a plan to manage them. And get support. So it's important to have people in your life who are supporting you and taking care of you too. You can talk with your friends and family. Many of our young adult survivors find it really useful to talk to someone else who understands it, who was in the same shoes, who went to the hospital and did the same types of things. So you can connect with other survivors online. Now it's actually probably harder to find the face-to-face support groups, but there's many online support groups, there's social media channels. There's lots of resources out there for survivors looking to connect to each other. You can also seek professional counseling. A great place to start is asking your cancer team for a referral in the area. They are often really knowledgeable people who are well suited to work with cancer survivors. Another really beneficial idea is to attend a camp or retreat for survivors. There's lots of really interesting camps or adventure type activities that can not only promote physical benefits by engaging in a new adventure and have a lot of, or it can also really build self-confidence and see yourself in a stronger light after participating. The other piece broadly is you really want to be a proactive stress manager, right? And so these are things that will sound really familiar to many of you, but there are evidence that these types of strategies work to help people manage their stress. So one is just really building a lot of positive things into your life. You want to do things that you enjoy, make you laugh. And the more you do that, the more positive emotions you have in your life. You want to think about ways to manage your body. So we talked earlier about that fight or flight response, right? And so part of what happens is your heartbeat starts to go really fast. Your breathing becomes really shallow. It's very focused only in your chest, like almost similar to if you were having a panic attack. It would be really a rapid breathing. But what we know is that actually focused breathing or doing deep diaphragmatic breathing into your belly instead of your chest helps slow the whole system down and really can be calm. And you can accomplish this in really just even a few deep breaths. It can help you feel your whole body can start to relax and feel less tense. Meditation is another really great thing that builds off breathing, and it really helps you stay focused on the present. And there are many really great meditation apps available for low cost or even some free ones online. The other thing is to try to even give yourself a new hobby. Think about something you enjoy doing, take a class, think about creative arts as something to express yourself, listen to music, exercise, as well as the emotional benefits of exercise, or obviously the physical benefits too. So there's a lot of great benefits for your fitness, for your mood, as well as your confidence in yourself and your body. Get enough sleep. I think young adults definitely do not do this. So think about ways to make sure you get your 7 to 9 hours of sleep a night, and don't shortchange yourself on that. Really prioritize sleep. Think about sleep hygiene. Try to turn off your phones a little, an hour or so before bed, so you're not getting all that light and the stimulation of that right ahead of time. But really think about a calming routine you can do for yourself. Get support. And another evidence-based strategy for managing stress is a positive psychology practice called gratitude. So thinking every day you find something to be grateful for, and think about, maybe even make a list. You write down 1 or 2 things that you're grateful for each day, or you just spend a few minutes thinking about it. And this has been shown to improve people's mood. Another thing we do in our work at the Cancer Center is we teach people a proactive strategy for addressing problems and stressors that they have in their lives called Bright Ideas Problem Solving. So this really, the figure on the right, you can see here, the center is optimism. It's the belief that you can overcome any challenge you face. You've already overcome a lot of things in your life. And so this just reiterates that you want to approach a problem with the belief that you can solve it and that you're capable of doing it, as long as you give it your best try and have some time and persistence to figure it out. And then there's 5 steps of problem solving. This will sound very familiar probably to what everyone does every day, but the steps here, the acronym ideas, is to really help you just remember to take it slow and go through each step in a methodical manner instead of just sort of rushing through to try to quickly move on to something. So the steps are to identify the problem. Here you're like a detective. You're thinking about the who, what, where, when, why, how, and really figuring out, okay, what's really going on here, breaking it into small pieces that you can think about being actionable on. Then you're defining your options with the D. Here you're brainstorming lots of ideas. What are all the things that you can do to solve this problem? Next, with the E, you're going to evaluate those ideas you just came up with and think about which one's the best in the situation. So you're going to look at the pros and cons and decide what's the most likely to work and the least likely to be, that there's something that you can't do. Then you're going to act. So then you actually just try to pick what you decided on and go forward and do it. And finally, what people often forget is to decide if it worked. So the C, if it worked, the S here is after you actually try one of your actions, really try to take some time to figure out, did that solve my problem or did it not? And if it didn't, don't give up. This is when you go backwards in the problem and try to figure out another way. And I think that's really that persistence that if that didn't work, perhaps you didn't have the problem quite defined as well as you wanted, or maybe there was a big barrier you didn't think about earlier. And now you can try to go backwards and see how to overcome it. So this is an evidence-based approach to trying to get you to think through how to best solve your own problems. And what I'll really emphasize here is that really you are the one who can do it. And even when we teach our young adults how to use this framework, they're still the ones that are coming up with all the ideas and carrying them through. So it's a nice way just to remember to yourself that you're capable of doing it, and just have to sit down and think it through. Now, we've talked about a lot of the challenges in survivorship. And so I also want to talk about post-treatment care and what you have to do after your initial cancer treatment's over. So there are different models of care. You can see here in this figure that the three main parts of your post-treatment care as a survivor are surveilling for any late health effects or recurrence of your cancer, prevention of new cancers. And so that it really encompasses both general preventive health behaviors as well as screening for other cancers. As you get older, there's lots of recommended screenings that you do for other cancers. And then thinking about any interventions for any of the late health effects that people have from their treatment already. And that's really, we've talked mostly about the psychosocial late effects, but there are also physical and effects that should be part of your routine care. And what I like about this figure is that if you notice, the biggest part of this is actually not what the care involves, but it's that care coordination piece at the top. And that one of the challenges in getting the right care is making sure that you're coordinating the care between yourself, your oncologist, your primary care health team, and any other specialty services that you have to see. And so traditionally, there's sort of three major ways that you might get care as a survivor. One is that you continue to go to an oncologist or specialist who manages your care. So that they're really focused on your survivorship care, but you also need to go to your primary care for general preventive health care. You might actually go to your primary care if you have a lower risk of some of these late health effects. Your oncologist may say, go, your primary care can totally lead your care. And then there's a shared care model where your primary care and your oncologist should be talking, and they should be sharing information back and forth and helping each other manage your care. And the idea here is that this care should be tailored to your individual risks. So based on what you received from your cancer treatment, as well as any other life factors that you might have. For example, if you have any genetic risk for other cancers, this would be part of your care. So we know that unfortunately, many of our young adults don't get this type of risk-based care. And so some of the barriers that are commonly reported to this care are a lack of knowledge from both the young adults themselves about what they should be getting and from their care team as to who's doing what. Difficulty navigating the complex healthcare system. So the adult healthcare system is really complicated. There's lots of different specialties you have to go to. They're often not in the same building or hospital. And you may even need referrals depending on your insurance status. So it can be really complex to navigate. Many of our survivors don't feel ready to do so. They often find too that the communication between their key providers or the systems that they go into don't work as smoothly as they like. It can be really disjointed and difficult to get the right information to the right people. Another thing that many of our young adults talk about is they feel different from their healthy peers who don't have a history of cancer, and they don't really know anyone else who has to go to the doctor as much as they do at this stage in their life. For our young adults, particularly our young adults who are survivors of childhood cancer, there's this need to transfer the knowledge of the treatment and late effects and all that from their caregivers to the young adult, and that doesn't often happen in an easy way. Health insurance is a really big barrier too. Although nowadays it's much easier to get some sort of health insurance with, our healthcare.gov having lots of low cost options. The problem is many of them many of our young survivors wind up being underinsured in that they have a lot of out-of-pocket costs, and it can be really expensive still if they don't have the right type of insurance. Luckily, if you're under the age of 26, you should be eligible to be on your parents' insurance still. And so that's something that we really encourage survivors to take advantage of if they can. And then finally, a major problem for our transitioning to a primary care provider from an oncology-led care model is that many of our primary care providers don't have any training in survivorship. certainly not with our younger survivors, and even practices where they see many older adults who are cancer survivors. It's a real problem for the field. The field broadly is trying to do training and get information out to primary care providers, but they may not see very many survivors in their practice. And so it's really difficult to manage that. So what can you do about these challenges? So first and foremost, one of the biggest things you can do is get a survivorship care plan. Now, this is a document that should be personalized to you. It should have a summary of the cancer treatments that you had, and also a list of recommendations for surveillance for the future. This is a great document that then you can share with your other providers. You can share it with your primary care provider, so you and your providing team know what are the things that you should be looking out for. The other thing we really encourage our young adults to do is ask lots of questions. Ask your oncology team, ask your primary care, ask everybody all the questions that you have. If you're not sure, ask the question, and really try to be an advocate for yourself. If something doesn't feel right in a relationship with a provider, you say something or go find another provider too. If you feel like you're not heard in that relationship or they're not listening to your needs, it may be time to look to see another provider in your network. The other thing you can really do is focus on your routine healthcare. So making sure you stay engaged, not only in your survivorship care, but your general preventive healthcare, healthy lifestyle, and maintain your insurance coverage. And insurance can be really tricky, but there are lots of resources out there, and I'll show a couple in a few slides to help you navigate the insurance system and answer questions about it. And I already said the healthy lifestyle. And I'd be remiss if I didn't also mention, if there are any caregivers or family members on the call, that the cancer survivorship is not just the survivors, right? Cancer affects the whole family. And so it's important for survivors also to attend to their own, and for family members to attend to their own psychosocial needs, as different events, milestones may affect different family members in different ways. And so it's important to communicate and also make sure everyone who needs attention gets it. I think also for our older adolescents and young adults, you might go through treatment and have young children at home. And you'll think about how do you talk with them about it at the time, and as they get older and start to process what happened too. This may come up at different times, or their fears may come out at different times that you'll have to make sure you address as they get older. So in conclusion, what I hope you learned tonight or heard about tonight is navigating survivorship. Stress is really common, and there's going to be fluctuations of distress throughout the survivorship continuum, some of which you will be very able to predict for yourself, and some things may surprise you. It's really important to acknowledge any concerns that you have, any unmet needs that you have, and seek help when you need it. There's lots of resources out there. And importantly, for general health, and particularly for managing any cancer-related stressors, is think about how to practice effective stress management techniques, engage in your regular healthcare and healthy behaviors, and remember that you're not alone. So there are lots of supportive people out there. There are lots of support groups, professional providers who can help you navigate your concerns. And so I also leave you with a quote from Maya Angelou, who enjoys that my mission in life is not merely to survive, but to thrive, and to do so with some passion, some compassion, some humor, and some style. So here are some resources. I didn't even put all of them out there because there's so many out there for our adolescents and young adults. The first link here is to our webpage at CINJ, and that's a little snippet from some of the resources. So there's links directly to many of the organizations that serve our adolescents and young adults. You can see a smattering here on the right side of some of the different organizations that, again, are focusing on young adults or adolescents and young adults. And as you look through them, they all have different resources. So some of them are focused on financial resources like SAM Fund. Some are more education and employment like Cancers and Careers. And then others cover a whole range of things. So I encourage you to check those out. I also, if you haven't seen this book, Between Two Kingdoms, it's a New York Times bestseller. There was the Life Interrupted blog for Suleika Jacquard when she went through her cancer treatment. And I think it really resonates with many survivors and family members. You might even recommend it to a family or friend to read her experience and how survivorship has been as much of a challenge as her original treatment. I also want to just let you know too, for anyone who's interested, we do have the NCCN puts out guidelines for patients for all kinds of supportive care and other needs. And so there is a new update to the adolescent and young adult guidelines. So if anyone's interested, you can email me or just Cynthia and we can send you a copy. And I am happy to take questions.
I have a question. So I thought that rates of depression and suicide were higher in young adults who are cancer survivors. Can you speak to that issue?
That they were, or
Mhm.
were, yeah. Yeah, so there is some data to suggest that the rates of depression and suicide are higher in young adults with cancer. I think that there have not been any, the data is a little bit older on that right now, but I would think actually with I didn't actually mention the COVID-19 pandemic, but we also saw data coming out of the pandemic that rates of depression and loneliness were a little higher among survivors broadly and our adolescent and young survivors. And we know that in general, the suicide rate in the United States has been going up in the last few years because of it's really been a bit of a mental health crisis, I think, really exacerbated by the pandemic and the isolation people have experienced. So yes, it is a concern. And I think the things we talked about today about really making sure you seek help is critical to getting the mental health care to prevent suicide and reduce depression.
There's a question from Caitlin in the chat, Katie.
All right, so I'll repeat it just for the recording. What do you think is the most beneficial avenue or the best choice in the attempt to address the unmet needs stressors you mentioned? Or what do you like to do think is the best form with this population? And since this population is so unique, like you mentioned, their stressors are different than others based on their point of life they're in. Even that is unique in and of itself. How have you seen that they are different from individuals who are later on in life as adults dealing with cancer diagnosis or no difference? Great question, Caitlin. So I think, so I think really getting the support needs is the critical thing. And honestly, I think what we need to do as healthcare providers is making sure that we're trying to address these earlier than possible and not waiting for these unmet needs to really result in distress or disruptions to life. And so I know that there have been efforts to really try to develop interventions that are targeted to adolescents and young adults and get them into, mostly so far they're at academic medical centers, but the idea is to get them out into community medical centers and other places where our young adults are being seen and may not have the support. In terms of responsiveness to intervention, I think, broadly, I think it's many of our young adults don't ask for help. And so that's something that maybe is a little different than older or younger counterparts that they're not routinely screened in many cases, and then they're not really seeking the help themselves. And so I think it's really, we have to go to them, and that is something that's important. But once we get to them, I do think they're highly responsive to treatment and to interventions and can be highly engaged, similar to, other age ranges. But I do think it's important to make sure we tailor it to their particular life circumstance and think that, we want our interventions to be flexible, because even if we build something for adolescents and young adults, as you mentioned, that there's so much variability with people that you really have to focus on, okay, what is this one person's real situation, and make sure that we're thinking about that person and not making any assumptions because they're in that age range, but really thinking about what it is unique to their life. I hope that has answered the question. Thank you.
I had a question about social isolation, and I've noticed in the young adults that I've seen that were between like 18 and 23, that because of the disruption in sort of schooling and sort of health behaviors and all sorts of things, that they just feel really different from their peers. And that it's just a huge loss because of leaving college or not being able to go to college, and then really being behind socially and not being able to drink or do things that some of their peers do. I was wondering what your thoughts are about that and how to assist.
Yeah, I think that's a common issue that we hear, is a theme that they don't feel, they feel like they're left out or not, they can't do certain things. And even I think not only in sort of real life, but I think on social media too, we hear that a lot, where they're seeing their friends doing all these things. And of course, social media itself is such a small snippet of someone's life that it just exacerbates sort of the difference, because it's sort of the best of someone else's life and you're worried about your own. And so what we normally really encourage people to do is find their group that feels right. And so it may not be the people that they thought they were. And we hear many of our young adults say, you know, I thought this person would really be there for me, but it turns out this other acquaintance is the one who now is a much closer friend of mine. And I think being open to shifting social circles a bit, and really making sure that there's at least a couple of relationships that feel really positive. It may not be as wide of a circle as before, but as long as they have some supportive relationships, that's what we want to focus on, I think. And I do think people will catch up down the road. It feels really difficult at the time, but there's ways to sort of get back afterwards. But at the moment, it feels very ostracizing to be, you know, off trajectory.
Thank you. Does anybody else have any questions for Katie? If not, thank you, Katie. That was really informative and really, really comprehensive and covered so many aspects of adolescent young adult survivorship. Jacinta, do we have another slide?
I think there's
Oh.
Yeah.
Thank you for filling. If you can, fill out the questionnaire afterwards, and remember that we have a talk next month by Alyssa Bark on lymphedema, which is a really common side effect of cancer treatment for patients going through treatment. And again, thank you, Katie. It was such an informative talk. And
Thank
please
you,
feel free
everyone.
to call us if you have any questions, or to email us, sorry, if you have any questions about Katie's talk or want any resources from the Cancer Survivorship Center. And thank you, everyone, for being here today. And thank you, Katie.
Thank you.
Thank you.
Hi, everybody. Have a good night.
Bye.